It's always an exciting time to have you join us on the program Healthy Living with yours sincerely, Oluije Uihohai. Today on Healthy Living, it's definitely going to take another dimension. When we talk about ailments, talk about sicknesses, we talk about disease, we talk about different things on healthy living. We most times just have doctors that come to talk about these things. But today we'll be having firsthand, yes, someone that actually went through this topic we will be talking about today. And if you're wondering out there, what's the topic about? Now, we will be talking about World Kidney Day, kidney health awareness. Yes, that is what we'll be dwelling on today. On the 13th of this month, March 2025, will be World Kidney Day. So today we have a survivor. Yes, she is a survivor, and she's a person of Esoe Sarah Usagede. She's also known as ASO. She is the founder, ASO Kidney Alive Foundation. She is a survivor and an advocate for kidney health awareness and providing support for kidney patients across Nigeria. So she will be joining us virtually from the United Kingdom. Good afternoon, ASO.
Thank you very much. Good afternoon. Good afternoon, Nigeria. Good afternoon, Edo State. Good afternoon, everyone.
Now, first off, how are you doing?
I'm great. I'm fine. Bless God. I'm doing great. After transplant, I'm living a very wonderful life. Thank God for that. Yeah.
Okay. All right. Now, first off, lots of persons out there will want to know how did it all start, the journey, the process. How did it all start with you?
Yeah. I was just a young lady who has a lot of aspirations growing up. And because I came from a very healthy family, I wouldn't think about kidney problem. I wouldn't even think about being admitted in the hospital because none of my siblings, not even my parents, have been to the hospital since I was born. So I was just living my life in a very ignorant way, not knowing that I've got an internal problem called a kidney problem. Yeah, so it started when I was 9 years old, and I was just having some symptoms, and my legs were getting swollen, my body structure was changing, and my mom took me to the hospital, and the doctors told her that something is wrong with my right kidney, but being the religious woman that she is, she just took me to church and said, "Look, my daughter will be fine and everything." To be honest, I was actually fine. But medically, I didn't know that my second kidney started working automatically, that the right kidney was already gone, and I was living with the help of the second kidney. And it took the space of 15 good years for this kidney to elapse. That's the second kidney that kicked off when I was 9 years. Yeah. So yeah, I didn't know that I had kidney problem. I was 9 when I was diagnosed, and it was not taken seriously due to ignorance, lack of education. And so for the next 15 years, I did a lot of practices that actually did not help the other kidney I was with. I did lots of, and I'll come to that. Some of the things that people do that do not know. Yeah. So that was me when I was really, really sick. Yeah. So we thank God at the end of the day, after 15 years, it's called chronic kidney disease, which I never knew. And unfortunately, I got diagnosed that my two kidneys are packed up. This was after I graduated from the university. And yeah, it was really tough. It was a tough journey, but that was how it started. But I think I was actually born with a weak kidney. This has nothing to do with whether I was smoking, whether I was drinking, whether I was doing anything. I was just 9. So I had internal problem, which we never knew about. Yeah, that's why it's always good to go for checkup, know your organs, know what you're born with, know if your organs are intact. It's just good to go for general check and know what you are, which I never did. So that was one of the reasons I had kidney failure. Yeah.
All right, thank you so much, Aso. Now, it will please you to know that before we go to, I know she made mention of the style of living. Before we go into that, we'll please you to know that World Kidney Day is a global health awareness campaign focusing on the impact of kidney and reducing the frequency and impact of kidney disease and it's associated with health problems worldwide. Now, the theme for this year's World Kidney Day is, are you kidney okay? Yes, are your kidney okay? Or detect early, protect kidney health. Now, the day is always been celebrated 13th of March. Now, when I went to check into statistics, do my research and all of that, I got to know that an estimated number of chronic disease persons, yes, it affects over 10% of global population, amounting to over 800 million individuals. Now, also 800 million individuals. Are we saying that the awareness of kidney-related issues are not being taken seriously?
Of course, of course. Kudos to a lot of organizations that are actually carrying out kidney awareness. But to be honest, the emphasis has not really been much. And for the few ones that are actually doing the awareness, including my foundation, people have not really taken this seriously. Maybe because they've not really heard it over and over again, the importance of taking care of their organs, and or it's just a matter of nonchalant attitude or ignorance. Because the truth is, kidney and internal organs like your heart, your liver, and the rest of them, your lungs, these things don't show in the face. So people don't feel like, oh, something is wrong in my body because it's done internally. So they're not taking it seriously. It's only when it comes to the surface, which means that it has already been damaged. That's when it comes to the surface. That's when people are realizing that, oh, it's true. I really have organ like liver, or I really have an organ called kidney. So I think the emphasis is still not enough in a country like Nigeria, where we don't have free medical facilities, or free medical health care. So the emphasis is not enough. If you look at the way Nigerians are living their lives, we still know that most of them are very, very much ignorant of kidney disease, of heart disease, of lungs, anything called internal organ. They are still very much ignorant of it. So I think the emphasis is not enough. We need to do more. And that's why I'm one of the leading voices in my state, Edo State, going about talking about kidney health. If there is any organization that is also doing this, I want to keep encouraging them to continue. And I want to encourage more organizations, especially from the government angle, to support the healthcare sector, to departments. We need to hear this. We need to emphasize on it, because I've seen a lot of news, even while I'm in diaspora. I still see news on how people consume medications, set medications, how people consume alcohol, even expired drinks, and all of this. A lot of things are going wrong in the country that people don't pay attention to, that actually eventually lead to kidney failure. So we need more emphasis on this. Yeah, we do need,
Okay, now, you
because the
made
case is
mention
getting
of
rampant.
self-medication. How does
Yes.
self-medication lead to kidney disease? And
Yeah.
I'm looking forward to looking at the symptoms. How do they manifest? What are the things we need to see? But first off, how does self-medication come into play?
To be honest, self-medication, we are used to that. As Nigerians, we used to go into the chemist. I won't even mention pharmacy. Pharmacy is even a very huge word, because the level of low standard Nigerians compared to the high, we have the high class, the middle class, and the low class. We have more of low class when it comes to economic class. So what these people are used to is to going to the chemist and just say, I think everybody feels any ailment in the body is malaria. That's what is rampant in Nigeria. So everybody just know, oh, go to this. Everybody's a doctor. I even see that these days on social media, where we see people just put this concoction together and tell you, if you drink this, it will it will reduce your stomach, slimity, and skin care products, where they are bleaching their skin and all of this. There are lots of things that we just do. We just give ourselves self-medication, especially when we are sick. If you're feeling migraine, you say it's headache, we'll go and take paracetamol, right? If you feel down and you say, oh, this is typhoid or malaria, without doctors diagnosing it, you just go to the pharmacy and ask for, give me Lonart, give me, there are lots of antibiotics, and there are a lot of malaria medication which are so strong to the body. And people don't know if they need it or they don't need it. They just give set medication and then keep doing this. Because I'm saying this because this was one of the practices I was doing without knowing that I was already living with my last chance of kidney. So I just go to the pharmacy because I was always sick. I didn't know that my kidney was packing up, but I was always feeling sick and I felt like it was malaria. I took a lot of medication, even with my urinary tract infection, because the kidney was failing. So it was affecting my bladder. So because of that, as a young lady, I want to treat toilet infection. I kept taking lots of antibiotics for toilet infection, and that alone is one of the leading cause of kidney failure.
Okay, okay,
Antibiotics, painkillers, things like this. Yeah,
okay. All right. It's nice to know that you are a survivor. So we want
yeah.
to know how do the symptoms, how do they manifest?
So, because the human body is different, I can't tell you. This is because it's happened like this on my body. This is how it's going to happen to
It
Mr.
might
A. But
differ for
however,
another.
yes, it differs. But however, there is a universal symptom that everyone should look out for. Okay, people should look out for when their bodies are beginning to get swollen. Well, even that's not even a symptom. That is after the kidney has packed up. Those are the signs you start seeing. That's when the damage has been done. But before that time, when your kidney is talking to you, they talk to us. Our organs talk to us. Just that we don't pay
Okay.
attention to them. We look at our urine when the urine is very colored. Some persons get colored urine due to dehydration. Yeah, but
Yeah.
when you drink a lot of water and your urine is still not clear enough, please go to the hospital and check. If you're still passing urine and your urine is very foamy, like that beer you turn on a glass cup and you see
Yeah.
those foamy substance on top of the beer. Some persons pass urine and their urine is very, very foamy. And people don't know me. For me, I was admiring my urine. I was like, why I don't drink beer? Why my urine foamy? Not knowing that that was a new sign that my kidney was telling me, go check yourself, check yourself. So
Yeah.
please check your urine. Urine is another thing that comes out of our body that speaks to us, that tells us what our body is going through. Okay. So if your urine is foamy, please go to the hospital and check. Then, secondly, if you are always feeling tired, this has nothing to do with cholesterol. This has nothing to do with because you're adding weight or you're too obese. No, if you know you're diet, yes, you need to work on yourself. But however, if you are not all of this and you know you're healthy, but you walk in a very short mile, breathing hard. You can't even climb staircase. I'm telling you, this was one of the things that was wrong with me. I was very skinny, but at the same time, I just can't climb one-story building because I'm so tired. In fact, in their house, people recognize me as a lazy woman because any little thing I get tired. I never knew that my kidneys were packing up. So you check your strength level, you check how you breathe. Most times you don't breathe properly. Your breathing is not coming down. So please go check yourself. I'm not saying because of that your kidney has failed, but it's always good to know because these things comes along with kidney failure. All right. Another sign you should look out for is if you're always waking up in the morning and you feel sweat in your body, like you're sleeping at night, sorry, and you feel a lot of sweat in your body, whereas of course, this is difficult in Nigeria to tell because most times people sleep with and wake up with sweat because it's a sunny and a very hot country. But this is unusual. This kind of sweat is unusual, and you just wake up, your body is soaked. Please, it's a very wrong sign. Go check your body. Okay. One more thing I would like to add is that when you drink a lot of water, because I realize that most Nigerians drink a lot of water, but you're drinking a lot of water and you're not passing enough urine. Okay. So if your water intake is more than the output, I'm not saying that it has to come at exact volume because the water goes to your body. It helps your body. It helps to glow. It helps a lot of organs in your body. So there's no way the same amount of water you take will come out. But however, you know that you consume a lot of water. But when you go to the bathroom or go to the toilet, you pass just a little piece of urine. Please, that is a big sign of kidney problem. You go to the hospital and check. It seems like your kidneys are not able to supply. I mean, the bladder is not able to supply to the kidney. So you need to check out for that, because bladder and kidney work hand in hand. Another sign as a young lady you need to check out for is urinary tract infection. Sometimes people just think they're treating infection. And if you know you're not a promiscuous woman, you don't move from one partner to another,
To
and you are
another.
very neat, you're very neat under there. You clean yourself, you're neat, but constantly you are treating toilet infection. Constantly. It will go this week, next week it will come back. Please go to the hospital and check your kidneys, because it's a sign that your kidneys are getting infection, which might later pack up to kidney failure. So please watch out for those signs.
All right, thank you so much, Aso. We'll definitely go on a short break right now, but just to let you know that when we come back, we'll dive into at what stage would we say it's acute kidney failure. When we'll come back, we'll dive more into that. Don't go nowhere. All right, if you just joined us, we're all looking at kidney health issues as regards to World Kidney Day, which will be on the 13th of March 2025. And sure, we have been talking to Aso Sarah Usagede. She's also known as Esoe Sarah Usagede. She's also known as Aso. She is the founder, Aso Kidney Alive Foundation. She is a survivor. Now, quickly now, Aso, before we go to acute kidney failure, at what stage would we say it's now acute? Yes. What are the causes? What are the causes?
Causes of kidney failure.
Yes.
There are a lot of causes. They are numerous, actually. It depends on the kind of kidney you're born with. Some of them, it doesn't just cause anything; it just pack up because they're actually born with, weak organs. Due to maybe childbirth or due to some complications in their mother's body during pregnancy. Then for others, there are people who just ignorantly practice poor living that leads to kidney failure. Some of them, most of them are, because it's an internal organ. So what we do to our body, most of the things we do to it is the things that we actually put inside our body. Okay, so we've got the types of drink we do, drink, the consuming alcohol. Like a doctor would tell me, there is no benefit in alcohol, so stay away from alcohol. So those of you that are getting high and think like you just want to enjoy yourself, the best way to enjoy yourself is to drink water. It's boring, but it will save you a lot of harm. Okay, water is the only liquid you put into your body that 100% causes no harm. So please, if you want to have a very healthy kidney, water is what you need to take in to lubricate your kidney, because your kidney is like an engine room, just like you have your car and your engine is there. And if there is no oil in your engine, it will pack up. So water is your oil that you use to lubricate your kidney so that they work effectively. And another is also when you are always dehydrated, you're causing harm to your kidney. Okay. And then another practice is what we many people go about bleaching their skin, which is very rampant in Africa. I don't know why we are not proud of our skin color, which even the white people want to have our skin color, and we want to have we want to be white. So who told you that fairness is beauty? Be proud of your skin, be proud of who you are, and stop touching the skin tone of your natural body, because it causes a lot of harm. Yeah, you don't know those chemicals that you're using, everything is going inside your body, and the kidney is the one that is suffering. So please stop that, because those practices can lead to kidney failure. All right. Lack of exercise. A lot of Nigerians are stressed. It's not exercise. When you ask most Nigerians, they tell you, if it's only the stress I'm going through,
At
no,
work.
it's exercise. No, exercise is different from stress. When you are stressed, you are actually stressing your organs, not apart from your kidney or your other organs like your heart and every other thing is also stressed. But exercise is different. Exercise, your body knows when you are exercising, your body knows when you are stressed. So please take exercise paramount, which will definitely help you. You cannot overemphasize on exercise. Apart from your kidney, a lot of organs in your body is going to definitely benefit from it. Okay. Another leading cause of kidney failure is, like I said before, self medication. You're just giving yourself. You don't see most Nigerians don't even know how to go to the hospital, to check themselves. Yeah, I want to talk to our young ladies because I'm after reaching out to young people because I'm a young lady. Those of you that used to buy expensive hair and look good, and yet you don't even know what's going on in your body. When sickness comes, your beauty means nothing to you. So please, even if it costs you 50,000 naira to go to the hospital and check yourself and know whether you're fine, it's worth it. It's better you know that you spend money on checking your health than spending money on things that do not even, that will fade away. Health is wealth. When they say health is wealth, I have experienced it. Health is wealth. When health is taken away from you, nothing matters anymore. So please take your time, mind what you eat, mind what you drink. Some of you will just eat and eat and eat. We don't care whether there's diet, whether there is balanced diet in what we're eating. We just consume anything, roadside food and all of that. We don't even know the content. Those kind of canned food is. I'm thanking God that Nigerians are not fully into those kind of canned food, unlike the way it is in abroad. But however, some persons are already embracing it. All those preserved food that we normally eat, and we don't know how long they've been preserved, the kind of chemicals they use in preserving those food, and most food that we are eating these days, especially those in abroad, are inorganic food. So they are being planted by chemicals. You see a tomato looking so beautiful. There is no sign of it getting rotten. Those things have a lot of chemicals. So when we consume them, we cannot stop consuming these things because they are part of our life now. But the only way you can help yourself when you consume too much of chemical food is to drink a lot of water.
Okay. All
Drink a
right.
lot of water to help. Yeah.
Okay. Now, Acer, we have different stages of kidney disease. Now, at what stage would you say it's that there is a solution?
Hmm. When we detect kidney failure or kidney disease on time,
Yeah.
I would say there is a solution. Yeah. Yeah. When your kidney is about key stage one or key stage two, I know there will be a solution. Doctors will tell you, oh, something is wrong with your kidney. Can you just do this and do that? Drink a lot
Okay.
of water and stop this practice. Something might be prompting it, so they'll be able to detect what's wrong. But once it gets to key stage three, key stage four, that means your kidney is packing up and there's nothing they can do about it. So early detection is still the best way to go. So please, even if you feel very healthy, there's still need for you to go to the hospital. Take your children, take yourself to the hospital and ask for checkup. And when you get your result, you know your state, then you know what to do. Even if the doctor tells you that you're okay, everything is fine, it doesn't warrant that you start living a life that is not pleasing to your body. It's a continuous decision to living a healthy life. So, like I said, early detection is still the key. You go to the hospital and find out. If it's not detected on time, that's when there's a problem. Yeah.
Okay. All right, let's look into dialysis. We find lots of persons complaining about dialysis, the amount that has been spent on dialysis. So, what do you think government can do to help, subsidize the rate of dialysis in our country, Nigeria?
Dialysis is like we always say, it's just a life sustainer. It's not the solution, but it will help keep alive kidney patients for some time. Okay, so I'm a Christian. I believe in miracle, and I also believe in transplantation because I have done it, and I'm a living testimony of kidney transplant. So dialysis is just to keep the people. It's in the middle. Okay, instead of the person staying without treatment, dialysis will keep you alive for a meantime until you get the final solution, which is either transplant or miracle. But unfortunately, in Nigeria, dialysis is very expensive. Or in Africa and some Asian countries, it's very, very expensive. There is no free medical care. So imagine dialysis, you have to do dialysis to stay alive when you have kidney failure. You have to do dialysis 3 times a week for you to have a healthy life. Okay. And now dialysis costs in the government hospital 50,000 lowest. in private hospital it's 100 and something thousand. So for someone whose salary is 50,000 and he has to go to the hospital in a week 3 times, paying one section 50,000 naira, I don't know. How do you expect that person to live? So this is the problem we are having in Africa, in Nigeria as a country. So it's very expensive, and that's the reason why I'm advocating for help. That dialysis patients are dying not because dialysis will kill them, or not because kidney failure is a death sentence. It's a deadly disease, but when you're diagnosed of kidney failure, it's just that it drains you. It drains you mentally, emotionally, everywhere. It stops you from doing the things you used to do. But however, it's not the end of the life. It's not the end of your life. If you can afford dialysis, you can still live a good life. But unfortunately, it's not like that in Nigeria. So the government needs to support. I'm hearing, I don't know if I should bring it out here. I'm hearing, I've seen the news, I've seen it on newspaper that President Tinubu is actually subsidizing dialysis from 50,000 to 12,000. But what I know is that it's not effective yet. It's yet to take effect. We don't know when, but that would be a
It will
very
kick
good one.
off.
I'm commending the
Yeah.
government for that. If that is really, really possible, I will be very happy to know that most dialysis patients can still stay alive, affording it. Yeah.
Okay, quickly now, your advice to everyone out there.
Oh, I want I want to first of all thank everyone. I know it's been a long time you saw me on TV because I remember when I was sick, I came out on ITV. I want to
Yeah.
first of all thank ITV and the crew for supporting me, for bringing me out for the general public to see my situation. Like you've been seeing some pictures, you see how I looked when I was really, really sick. I cried out, and you all listened to me. ITV was one of my backbone, displaying my pictures, just telling people this girl need to stay alive. And thank God I am alive today. And I keep thanking everyone that God has used to contribute to this beautiful life in front of you today. And that is why I'm coming out again to say, this time around, you're not helping me. Let's also use that same opportunity that you gave to me to live, to reach out to many kidney patients in Nigeria today, especially those in your state, Edo State. There are a lot of people who still need help. I am not the only person that needs help that you attended to. A lot of people are still struggling in the renal units today. They're crying for help. They need financial support. They need moral support. So
Yeah.
please, everyone, join my foundation. If you have to reach out to my foundation, reach out to ITV. They will link you to my foundation. If you need to help, lots of kidney patient needs your help. Please,
Okay.
just like the way you helped me, you can still help these people because
All
every life
right.
matters. Yeah.
Okay.
Thank you.
Thank you so much, Ato, for finding out
Thank
time
you.
to be with us today to talk about your own experience and helping others
Yeah.
out there. So we'll be seeing you again next week for another exciting time on Healthy Living. Stay blessed and have a blessed day. Bye for now.